And speaking of skin microbiome and topical, what are your thoughts on shampoos? What are you recommending and what are you saying stay away from when it comes to hair loss?
Yeah. So it's a complicated topic for sure. And if you're not sure about that, all you have to do is take a little stroll down your supermarket shampoo aisle and you'll see thousands and thousands of bottles of shampoo and conditioners and so forth. So scalp hygiene, right? Keeping the scalp healthy and treating your hair properly, right? Because hair is a fiber, right? So if it gets oily or dirty or product builds up or you've mistreated it, it's going to lose its aesthetic value, or it could actually even break. It could, physically snap, right? From over styling with chemicals and heat. So there's a whole variety of things that we need to consider before we recommend a shampoo. And actually, I have an entire department dedicated to that in my practice. So I have a trichology salon, so to speak. It's not really a salon, but it's a scalp care department in my office. Trichology is the care of hair and scalp. I have a certified, internationally trained trichologist, Kimberly. She's amazing, and she's also a cosmetologist. So anytime there's some disruption of, let's say, scalp health, and this is common: itchy, oily, flaky, dry scalp, or seborrheic dermatitis or other conditions, scalp acne, or even just dull looking hair, brittle hair. She can handle that by doing a complete evaluation of the scalp, looking at it scientifically, to determine this correct sequence of scalp care and scalp hygiene that could be detailed and unique for each particular patient, to be honest. So looking at, for example, scalp pH level, moisture level, sebum level, looking at the hair quality, the texture, is it colored, is it not? Do you straighten it or smooth it or not? What's the length of your hair? What kind of products do you use? What kind of environment are you in? Do you work outside? Are you an athlete and you're playing tennis or golf? Do you spend time on your boat? Are you in the water? Is it salt water? Is it chlorine? Do you color your hair? Do you, blow dry it? All of these different things are taken into consideration in order to kind of dial down into exactly what you should be doing in terms of the correct shampoos and conditioners and other therapies and other treatments for the scalp. So it's a simple question that has a very detailed answer, unfortunately. But I will say that the vast majority of patients in the practice, because they have thinning hair, they want some kind of hair care product that has therapeutic value, not just that cleanses the scalp and the hair or conditions and softens the scalp and conditions the hair. So my Bauman MD products have things like caffeine, saw palmetto, green tea extracts, and these are all ingredients that are going to have very, very specific properties at the level of the scalp in order to improve hair follicle function and to keep the scalp healthy. We have some CBD components coming out in our hair care products. And so I encourage our patients to be on the lookout for that. And we've also learned through some research at the University of Miami that hair follicles have this unique olfactory sense that they can sense. Your hair follicles can actually smell certain fragrances and scents and respond to them. And so many of my new hair care products, which are soon to be available, have these kinds of stimulants in them as well, which are going to be great for a healthy scalp and of course, excellent hair growth.
Yeah, it's a wonderful inside and out approach, right? Because it's what you put in your body, also what you get rid of in toxins and chemicals, and then it's what you put on your skin as well to nourish it.